Tramadol is a painkiller that is sometimes used in dogs. It might be used for short-term pain relief after surgery, or it could be used for long-term to treat something like arthritis. Does Tramadol actually work though, and is it safe? Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live a healthier, happier life. Let me know your experiences with Tramadol in the comments down below, and remember to subscribe for more videos just like this one. Tramadol is an opioid painkiller, commonly used in humans, that is also often given off license to our pets. In people, it can be very effective, but as we know from other drugs, the effects of a drug in one species doesn't mean that the same is true in another species. So classic opioids such as morphine and methadone we know work very well in dogs, so why would Tramadol be any different? Well, Tramadol needs to be broken down by the body into different chemicals, and it is these metabolites that are actually responsible for the analgesic or pain-killing action of Tramadol. It is a specific chemical known as the M1 metabolite that works on the opioid pain-killing receptors in the body, which then results in the pain-killing effect seen. Now, the problem is that dogs seem to produce very little of this M1 metabolite. Compounding this, it only lasts in the body for a very short time. Tramadol does have other effects on the body. It actually increases the levels of serotonin and norepinephrin in the body, which can have the effect of sedation or intestinal upset. Serotonin is also commonly known as the feel-good or happy chemical, and it is possible then that this makes our pets feel happier in themselves. The other side effects we rarely see, but they can include agitation, anxiety, tremors, dizziness, as well as inappetence or constipation. Generally though, any side effects are very rare and really minor. So the big question then is, does Tramadol work to reduce the pain my pet is in? Well, for some time now, the use of Tramadol has had its champions, and then it's also had those who have questioned how much good it actually does. So personally speaking, I have found that in some dogs it seemed to work well and improve their welfare and make them more comfortable after taking Tramadol. Other patients though, they didn't seem to get much or any benefit at all out of it. More often than not, I would also use Tramadol as an additional pain-killing strategy, using it at the same time as another pain-killing medication rather than using it on its own. The key with any pet in pain is to continually though reassess their comfort level. So if something doesn't seem to be working, changes can then be made to make sure that they are really as comfortable as possible and on the most appropriate treatment strategy. Why might Tramadol not work? Well, as I've already mentioned, dogs break down Tramadol differently to people, and Tramadol itself doesn't actually have any pain-killing activity, and instead it's the certain breakdown chemical that reduces pain. If only a small amount of this is produced and it's only around for a short time, the result is that theoretically it's questionable as to how much good Tramadol actually does. And a great recent study looked at this very question in lame arthritic dogs. It compared how much force was being put through each dog's legs after being given either a non-steroidal anti-inflammatory drug, and I've done a video about these specific drugs which you can see up here or link down below. They were also then, another group was given Tramadol and another group was given a placebo. So when you have a painful leg, you try and put much less weight through it, and so less force goes through it. And what this study found was that there was a great improvement in leg use with those dogs given non-steroidals, but there was no improvement and no difference with both the Tramadol and the placebo group. So if this is the case for every dog, then why might we see an improvement in some dogs being given Tramadol? Well, it could be due to two things. And the first is that the other effects that Tramadol has on increasing the serotonin levels that I've already discussed. So that might cause sedation and it might improve the feelings of happiness. And so our pets may actually look better even when they are actually in the same amount of pain. The second possible cause of this improvement is actually the placebo effect. Now, this is definitely an issue with both owners and veterinarians. We are all so invested in the health and the well-being of our dogs and cats that we want the treatment that we give to be working. And so this can mean that we see improvement even when it's not actually present. I've actually got a separate video coming up to discuss this topic in a few weeks, so make sure you look out for that. So for me, my nagging doubts about how well Tramadol actually works as well as the fact that there are alternatives out there have meant that it's not a drug that I actually really reach for in my patients anymore. If you want to learn about some alternative medications, as well as other strategies to help keep your painful pet as comfortable as possible, then I'll have a whole playlist on this topic that is linked here and down below. Keeping our pets as comfortable and pain-free as possible, it's something that I feel very strongly about, and I hope this video helps your pet to be as pain-free as possible. If you have any questions, as always, then please leave me a comment down below. I'd love to read them. Also, remember to subscribe to make sure you don't miss out on more videos just like this one, all about helping you and your pet to live a healthier, happier life. And until next time, I'm Dr. Alex from Our Pets Health, because they're family.